Hi, my name's Rebecca Mills, and I am here to speak about autism spectrum disorder. I think sometimes there's a little bit of confusion about what autism is, and you hear the terms Asperger's and PDD, and I'm going to try to explain that as best as I can to you in a short period of time. But I have a son that has Asperger's syndrome. He's 5 years old. And he attends Breathe, and it's a wonderful thing for us. So everybody, we really appreciate everything that you all do. So the definition of autism is that it's a complex developmental disability that causes problems with social interaction and communication. Symptoms usually start before age 3 and can cause delays or problems in many different skills that develop from infancy to adulthood. So what is an autism spectrum disorder? It's different people with autism can have very different symptoms. Healthcare providers think of autism as a spectrum disorder, a group of disorders with similar features. One person may have mild symptoms while another may have more serious symptoms, but they both have autism spectrum disorder. I'm going to draw a little diagram of autism spectrum disorder. So someone down here on the low end of the spectrum would have what you call classic autism. And that would be someone, that would be more along the lines of someone that cannot communicate, that always needs assisted living. And then on the higher end of the spectrum, you have Asperger's or PDD. And PDD stands for pervasive developmental disorder. They all share these common characteristics. That's why it's called autism spectrum. So, you know, whether they're down here or up here, they're all going to have repetitive behaviors or impaired communication. Be inflexible with routines. It might be hard to get one of your buddies, you know, interested in something, you know, to do something else. And a lot of times they have delays with their motor skills and sensory issues. And so sensory issues are, that's another topic I'd like to talk about. Sensory issues, a lot of children with special needs, all of their senses can be heightened. So when they walk into a room and the music is loud, it can be 10 times more loud to them. Or bright lights can be much brighter to them because their brains work differently. They can be, they just like getting messy. So this is important to Breathe volunteers. Because you need to recognize the signs of an overstimulated child. If they are covering or closing their eyes or hiding, or maybe they're covering their ears with their hands, you know, something may be too loud. They're being uncooperative or defiant, and running uncontrollably or running without purpose, or have aggressive behavior. And then another thing is stimming. A lot of children with autism, a stim is like a repetitive body movement. My son does this sometimes when he gets upset. His hand shakes like this. And they can do it, you know, maybe because it helps them think or concentrate, or it assists in bleeding off excessive excitement about something. So just want to, and you know, they say if you've met one kid with autism, you've only met one kid with autism. They're all very different, but these are just some very common things that if you want to, you know, you start to see a little bit of distress, you got to make sure you contact a Breathe Corps member in green, right? Green shirt. So thank you.